I am Ignatius Majamanda from Malawi. Whilst in Malawi, I was diagnosed with the squamous cell in my esophagus. What it meant was I had a tumor in my esophagus and it had to be treated. My wife insisted that we needed a second opinion, which we did. We started contacting doctors in India and we had a very good response from Manipal Hospital. So at that point, we started sharing information, all the CT scans that were done in Malawi with doctors in India. Crisis was that I was struggling to eat and drink. So even water was a problem to actually take. So I went through chemotherapy, 6 cycles. The idea was to shrink the tumor. The tumor was shrunk. Dr. Suraj and Dr. Hemanth did the surgery.
So at the diagnosis, we did a PET CT scan and found it to be a little advanced, although it is not spread to any other parts, which was very good. So we offered him a form of therapy known as neoadjuvant therapy, reduced the size, made sure that it is confined only to the esophagus, and then we proceeded to what was known as a robotic esophagectomy.
This surgery is where we remove the entire food pipe from the neck until the abdomen, along with all the lymph nodes where the tumor can potentially spread. And then we construct a tube from the stomach, which replaces the native esophagus and is joined at the neck. It is quite an arduous and tedious surgery, and it takes us about 6 to 8 hours because there are 3 phases in the operation. One inside the chest, one in the abdomen to make the tube, and then finally in the neck when we join. So conventionally, this has always been done with an open approach, and later we shifted to thoracoscopic and laparoscopic, that's a minimal access approach. But nowadays we have shifted to the next generation of technology, which is the robotic approach. And we are happy to say that he tolerated the operation extremely well.
I can eat now without any problem. I can drink without any problem.
So overall, he recovered very well. We saw him recently, about a week back in our outpatient. He was very happy.
I would like to thank all the doctors, all the nurses, everybody in the hospital, very professional, and I would recommend this hospital to anybody, not only cancer patients like me, but I think seeing what's happening in this hospital, one can actually have that belief to say most of the patients that come in go back with a smile. I'm going back with a smile to Malawi. Thank you, the Manipal team. Thank you, all the doctors.